Mikayla Ingebrigtsen, and this is my end of internship reflection. The first objective I had was I will interpret different patterns of heart rhythms on a heart monitor by the end of my 5 weeks on the cardiac ICU, as indicated by my ability to differentiate sinus rhythm from atrial fibrillation, ventricular fibrillation, tachycardia, bradycardia, etc. I definitely improved on this. Like 100%, I improved on being able to read a heart monitor. I could identify AFib by the lack of P wave. I could identify VTach, bradycardia. I found Bigemini to be kind of cool to try and identify. Never got very good at it. Ventricular tachycardia. I never had the chance to just observe it because when it happened, things got serious. I definitely improved, and that was due to the help of my preceptor who taught me a lot. And we have to save strips every 8 hours, so 8 a.m. and 8 p.m., or I guess 12 hours, 8 a.m. and 8 p.m. And so she would explain to me the QRS, the PR intervals, the ST intervals. So I feel like I definitely improved on that. The second objective I had made for myself was I will engage in clear and concise communication while talking with the interdisciplinary team by the end of my internship at the end of July, as indicated by instructor feedback to provide constructive criticism and encouragement for what I excelled at. I did not have many opportunities to interact with the interdisciplinary team in the hospital, but I did in the clinic. I felt like I actually got to form relationships with the doctors and pharmacists and LPNs and PCTs in the clinic, more so than I did in the hospital, because I was very busy in the hospital and I spent a lot of time with my nurse. So I thought I got a lot of practice in the clinic setting, and I think I excelled at it. And my preceptor also told me that she felt I was getting better at it as it too, for stating my opinion with what I thought was going on with the patient. She did say I could have a bit more confidence, which I totally agree with, and I think that will come with time and as I learn more and have more experience. My third objective was I will operate common ICU equipment, such as infusion pumps, without assistance from my preceptor by the end of my 5 weeks in the ICU. I did meet this learning objective, especially with infusion pumps. I gained 1,000 times more confidence with my ability to manage the pumps, obviously with the supervision of my preceptor, but I didn't need her to tell me how to do it. By the end of it, I knew what medication to click, dosage, time, infusion rate. Like I could do it all. And she did let me titrate a few times, but with those titrations it was a little bit scary because those were more unstable patients. But yes, I can use an infusion pump without the direct supervision, I guess. Well, no, I was supervised, but I didn't need to be told how to use the infusion pump. I also learned my way around a ventilator, bear huggers. I learned a lot of stuff about common ICU equipment. My fourth and final objective was I will demonstrate how to do a full neuro assessment by the end of July at the neuro clinic, as indicated by not missing a step in the assessment and my preceptor not having to remind me of a step in the assessment. I did not meet this objective simply because I never got the chance to do a full neuro assessment. That is not what they did in the neurology clinic. It was more so split up into different teams. There was the multiple sclerosis team, headache team who dealt with a lot of migraines, the seizure and epilepsy team, and the movement team who dealt a lot with Parkinson's. We did not check pupil sizes. We did not do alert and oriented questions. We did do some tests such as the 9-hole peg test, walking test, eyesight test. We did strength, but it was never a full neuro assessment. I did get to do some of those skills in the hospital, so I didn't feel completely robbed of that objective, but I definitely did not achieve it. My highs of this experience mainly occurred in the cardiac ICU. I got to witness so many things. I got to witness my first code. I got to learn so many new medications. I got to create relationships with so many patients and people who work on that floor. I learned how to navigate pumps, trachs, ventilators, and I just really learned how exciting it is when your patient gets better. It's devastating when they get worse, but when they get better and get to get discharged, those were the best days because I was just so excited for them to go home, especially the ones that were there for a long time. I also have to give it to my preceptor to why I had such an enjoyable experience in the cardiac ICU. Her name was Peyton Singer, and she was wonderful. She was great. She taught me so many things, and she was so understanding, and she showed me how okay it is to make mistakes or to ask for help rather than make mistakes. She would ask for help all the time, and she was incredibly smart. So that made me feel a lot more comfortable. And she never made me feel bad for asking questions. This experience made me realize I want to be a cardiac ICU nurse at some point in my life. Hopefully right out of school, but that's wishful thinking, I think. But I enjoyed this experience so much. I never thought I'd be an ICU nurse, but I loved it. My biggest low of this experience also occurred on the cardiac ICU unit because I witnessed my first patient death, and it was extremely hard on me. We had admitted this patient the night before as he was a post-cardiac arrest, and he was very unstable. We could not get his blood pressure up, and we could not get him to stop seizing. He would have intermittent seizures, and he was just not there. His pupils were unreactive, and he was pretty much brain dead. The next day we got there, and the family had all showed up. His family was all 4 of his kids and their partners, and you could tell when you walked in the room that something bad was going to happen. It was very somber energy. They still had a lot of questions for doctors about what the possibilities were of him getting better and what rehab would look like, but ultimately this family decided that it would be best to put their father on comfort cares. And we all knew that when he was put on comfort cares, he'd be gone within the 10 minutes afterwards. So they extubated him and took him off vasopressors and just tried to make him comfortable and make him look presentable to the family so he could die peacefully in their presence. I didn't know how hard that was going to be, but as soon as they said they were going to go comfort, I just felt like I was going to cry. I tried to hold it together, and then my preceptor asked me if I was okay or if I was going to cry, and that's when I started crying, and she brought me to a private place and talked me through it and said, we're going to make him comfortable. It doesn't get much easier, but you learn how to deal with it better, and that I shouldn't be ashamed that I'm taking it so hard. She shared her experience with me in her first death, and I also asked my mom about it, who is also a nurse, and she said it was very hard for her too. So I didn't feel alone in this situation. I think it was an important experience to have, and I think I am thankful that I had it. I think I'm a very sensitive person, and it was very hard. I learned many significant things throughout this experience. I learned new skills, how to interact with so many different types of patients, how to better manage my time, how to prioritize, and I learned so much new knowledge about the brain and the heart. It was amazing. But I think the most special thing and significant thing I learned in the hospital and neuroclinic is who I want to be when I'm a nurse, what type of nurse I want to be. I want to be knowledgeable. I want to be skillful. I want to be empathetic. I want to be a team player. I want to be kind. I just want to be the nurse that I would want. And I'm determined to. And I have so many role models now to look up to from this experience. My preceptor, so many nurses on the cardiac floor, so many nurses in the neuroclinic. They all just were so empathetic and so welcoming and kind, and it just made me appreciate the career I'm about to go into. I know it will be hard and not always easy, but I know that this is what I want to do, and I know who I want to be as a nurse. That could change, obviously, but I think right now where I'm at, I'm very confident that this is what I want to do, and I know who I want to be. And that is the end of my reflection on this internship.